we're looking at the stages of healing here, right? So if we look at post-injury, the very first thing that happens is an inflammatory response. And that inflammatory response is usually 2 or 3 days, but up to a week, let's say, where we get platelets that are rushing in, bringing growth factors and creating and stimulating that tissue repair cycle. The bulk of probably what we see in therapy are patients that come in really in the proliferative / reparative phase 2 or 3 weeks later, right? By the time they injure themselves, they're in denial, they try ice and all this stuff at home, they maybe go to the doctor, hopefully go to the physician to get screened. By the time they get on the schedule to come see us in therapy, it's 2 or 3 weeks later. So, the times we're seeing a lot of the patients and or the majority of patients obviously is as early as possible, but the reality is it's probably closer in the proliferative reparative phase, which is probably the most important part of the healing, where you're getting collagen deposition, tissues getting revascularized, growth factors are being secreted, and basically cell proliferation is happening. And we'll talk next month on the biologics. That's a critical component of how the biologics PRP stem cell work, is basically facilitating that cell production, letting the inflammation roll on, and get into that remodeling phase where we can pull out our tools, or we can pull out some of the manual techniques and really work on getting that tissue to realign so it's healthy and parallel and in the anatomical state that it's supposed to be functioning in.